would be your priority for you?
I think it's like identifying
Digestive issues?
Well, there's that as well.
So we've talked about digestive system. Can I have a little look at your tummy?
Yeah.
And hold. Less so. Okay, so that's grapefruit. I can understand because that area there is so firm. And by the time I'm on the third, it will feel so much better. Giving the back a little Tuina. Not too bad actually. A little bit tight here. Relaxing the elbow down, lovely. So letting it go. That's it, nice and heavy, heavy, heavy. Beautiful communication and connection going on. And lovely neck release. Letting it go nice and heavy all the way tilted back. So Juliet, last time you were here, you had a full body massage and scalp massage, and so I think you enjoyed it.
Very much so. Yes, it was lovely. Yeah,
Good.
Much needed, and it was lovely. Thank you.
And you've seen core therapy on my YouTube channel.
Yes, I have. So I'm interested in that.
Yeah, you're curious as to what might come up, and because you never know what's going to come up. Actually,
no. So it'd be really good.
So obviously I've treated you before, and you've told me in your consultation form bits and bobs. What would be your priority for you?
I think it's like identifying aches and pains and see how we can resolve those.
Okay.
You know.
Digestive issues?
Well, there's that. I still get reflux and the odd indigestion. They gave me an endoscopy and they couldn't see anything wrong, but I was on quite a lot of medication for it, so it's good to be able to cut down.
And how's your sleep?
That's not too bad. Yeah, sometimes it takes me a while to get off, but generally speaking, that's okay. Yeah.
And any headaches?
No.
Good.
No, they've been a lot better.
I'll be doing the kinesiology first of all, and then I'll be picking different techniques from the traditional Chinese medicine toolbox of many, many options to be able to treat whatever comes up in the kinesiology.
Okay.
So if you'd like to lie down. Okay, let's have a look at you. So if I could have a straight arm, so other hand off your hip, nice straight arm raised up, lovely. I'm going to push here, you're going to hold up and stop me pushing, and hold. Lovely, that's a good hold. And hold, lovely, nice. Nice and assured. So I'm going to push here, you're going to hold up and hold. Okay. And hold. Lovely. Okay, so legs are slightly weaker than the arms. So I'm just thinking about the pelvis now. So arm and leg together. And I'm going to push, you're going to hold up with both and hold. Okay, so it's not supported. And same this side and hold. It's better that side. So obvious, left to right. Did you notice that?
Yeah.
So I'm just having a little feel of the back of your left hip on the side of your sacro, about down the line of the sacroiliac. Is that a bit sore there? Yeah. Is it sore lower or upper or both?
Lower.
Yeah. Okay, arm and leg again and hold. Much better. So I'm really pushing.
Yeah.
And you're then supporting it because I anchored it. And I'm saying to your subconscious, is this where the problem is?
Yeah.
And then it's answering me by going, yes.
Wow.
Because it was weak before.
Yeah.
Okay, so arm and leg opposite sides and hold. Okay, foot's wavering a little and the other sides and hold. Nice, lovely. Just wondering about that, so I'm just going to check it. It wasn't too bad, but I'm being picky. So this arm up for me and hold. Nice, lovely. Lovely top. And hold. And hold. Good. No, they're all really strong. And hold. Slightly on the hip. Ooh, knee feels a bit stiff.
Yeah.
And hold. Yeah.
So I say that's, I've got a bit of an injury there at the moment.
Up and hold. Okay. Why? What have you done?
I don't know, it's fine, but it's like, 'cause, you know, I go to the gym, I struggle to do lunges. I don't know, you know, something's
With
not
that
right
knee?
with that knee.
And you're okay this side?
Yeah.
Yeah. Okay, I'll have a look at the knee
Yeah,
then.
thank you. Yeah, sort of when I've done some exercise, it's a bit sore going up the stairs, you know, walking upstairs. Don't know what I've done there.
Okay. Okay. I'm good with knees.
Good.
Can you bend your knees?
Yeah.
Feet on the couch and raise your head off the pillow. Can you give me a straight arm and hold? Okay, a little bit wavery. Head back down. Can you tilt your knees over that direction? Turn your head this way. Eyes go up to the corner and then raising this arm again and hold. Fine, lovely. Knees to me. Head turns. Eyes up. This arm and hold. Lovely. Okay, so you're good with that. So that was your rolls. You can put your knees back down. I'm just going to check the opposite sides and hold. Lovely. Okay. And hold. Okay, so we just analysed your walking gait. So that's pitch, roll and yaw. So pitch is when you had your head up and your knees up. And that's when we're getting out of the seat. I call it the jaw jut, because we have to do that to get up. We jut our jaw forwards. Or if we're starting to walk, we have to come off balance to be able to walk. It's the jaw jut. That was a little bit weak, but then when I tested your roll and your yaw, so a roll is when we're rolling one shoulder in and the opposite hip in, as we should be walking like this, you know, rather than carrying lots of stuff. We should be rolling like this. You pass both. And then yaw is the opposite. So when one shoulder is rolling in, the other shoulder is yawing out, Y-A-W. And the same with the hip. The opposite hip is yawing out as the shoulder is. So that's when I tested both sides bilaterally. Fine with that. So that's really good with your walking gait. So you mentioned about knees, so I'm just going to have a little look at this. Well, I'm going to check both knees. I'm going to have a look at the better one first. Okay, so I'm going to kinesiology test each side of each knee. Can I have this arm again and hold? Okay, that's not great. Yeah, it's all right. It gives me something to work with and hold. Yeah. So it's just on the inside, interestingly, and hold. So lower is fine, just checking above and hold. Oh no, okay. All right, so it's above and inside. Just going to check the lymph and hold. Not 100%, sort of 80%, yeah. So I'm just going to check the other knee and hold. Okay, slightly. Just check inside, or you tweak them and hold. There's no strength there at all.
No.
Interestingly, it's both knees inside and hold. Yeah, you're all right below. And above and hold. Not great, not great. Okay, so mainly inside, but yeah. So let's just check the lymph on the back of that knee and hold. Okay, not too bad. So they're not the same, but yeah, I'll be treating both knees. There's lots I can do for knees. So I'm going to give them some leg repatterning, which helps realign the knee. So inside the actual workings, the tendons, ligaments, etc. should restructure into the position they should be in. I'll be working with the pelvis as well, and actually the pelvis is like the ruler of the knees and the ankles, the feet. So once the pelvis is in the correct position and aligned correctly, that will have ramifications for the other joints. I'll also be doing some Qigong, some healing, beautiful energy work with the knees as well, which is a lovely sensation. And I might do some floating just to refigure them.
Okay.
Yeah, it's a nice feeling. So we've talked about digestive system. Can I have a little look at your
Please.
tummy?
Yeah.
You okay if I help myself?
Yeah.
So I'm just going to have a look at the valve about here. So from the hip point to the navel, about halfway along if you were to draw a line. Okay, so it feels a bit firm there. Is that a bit sore? And it's talking to me. I think it did last time actually.
Yes.
So that feels a bit firm, but let's see what it's telling me. So 2 fingers from the hand, deep where mine are, into there. How does that feel?
Yeah, I can feel it, but it's a little bit painful, yeah.
So I'm going to push and hold.
Oh
Do you
dear.
want to try that again? It's just a double check.
Yeah.
And hold. You just can't support it.
No,
And I'm
that's
actually
strange.
hardly pushing. I was trying to give you a fighting chance
Yeah,
then.
that's strange.
We have another valve over here called the Houston valve, so it feels the same.
Yeah,
So we're just going to double check that one. So 2 fingers into there. We're going to check with the same arm. A little bit lower than that. And hold. No. I think I might need to give you an Anmo Fu.
Wow.
Yeah. I mean, you know, your body will go, I know what I need, you know,
Yes.
this is what I need, and then I need some knees, and by the way, can you work on my spine and my back? Yeah.
Fabulous. Yeah. It's amazing what comes out, isn't it?
It is.
Yeah.
You know, sometimes I think, oh, do I sound a bit harsh when I'm saying, oh no, that wasn't a good test, you know, oh dear, you know, things like that. But then I think, at least I'm finding things that your body is saying. I mean, you wouldn't want to walk out of here with me finding absolutely nothing if you're coming in with symptoms.
Definitely, yeah.
You all right with me doing this?
Yeah,
just tucking in?
right.
Yeah. As soon as we start relaxing, our stomach starts making noises.
Right.
And so it's a real compliment to a therapist when the client's stomach is starting to rumble.
Ah, right. Yeah. Because it's relaxation.
Yeah, it shows you're letting go of all those in spasm muscles and they're just going, and letting it all work again.
Yeah.
Now, knowing what you've told me, we're just going to test a few oils like we've done before with the kinesiology and see what comes up. Juliet, can you, with this hand, give me a little finger and thumb? Yeah. I'm going to try and pull apart. You're going to hold together firm and hold. Okay, so I'm really pulling, aren't I? Yeah, but you're nice and strong. So, with this hand, can you hold that to you there on that valve? I'm going to pull again and hold. Nice and strong. So we've got a few to go. And hold. Lovely. So far we've got lemon and marjoram. Lemon very cleansing, marjoram very relaxing, and hold. Lovely. Got another positive one there, lavender. And hold. Less so. Okay, so that's grapefruit. And hold. Nice and strong. Lovely. Well, we've got 4 already. I'm inclined to just use those rather than carry on. Is that okay?
Yep.
Yeah. tea tree, lavender and sweet marjoram. I can hear your tummy.
I know, sorry.
No, it's good. It's a good sign. So, this is how it smells.
Oh, that's lovely. Oh, I like that.
Yeah.
Yeah, very nice.
Can you detect them all? Yeah.
Yeah. Lavender is lovely.
Oh, it is, isn't it? Yeah. It's been warming, unlike my hands.
That's all right.
Of course, I did massage your abdomen when you were here last.
Yes. Yeah.
That may well have kick-started you on the correct path with your digestion and it all improving as
That's
well.
right,
A
because
really good abdominal massage.
Yeah, because it has been last 3 or 4 weeks really. It started settling down, so yeah.
And I saw you about 3 or 4 weeks ago, did I?
It is about a month, yeah.
Yeah, lovely. Where we were testing has gone rosy.
Oh, has it?
Yeah, it's a little red.
So is this like to do with the colon, is it, or valve, or when you say valve?
Ah, you mean the ICV, the iliosacral valve and the
Yeah.
Houston
Yes,
valve? Yeah. So the iliosacral valve, the ICV, is a valve that has flaps, just like in our circulatory system. So imagine a tube, and at a certain point there's this place with flaps, and it allows clear movement of food. By this time it's called chyme, through the valve. And the valve should open and close when it needs to, at the right timing, not left open, not closed too much. And lots of things can happen to this valve. So it can be blocked open, so something can be blocking and allowing all the rest of the food through far too quickly, in which case you wouldn't be using the nutrients in your food that you are eating. They'd just be passing through you, and it would make you quite ill because you wouldn't be gaining your vitamins and minerals and proteins, etc., that you need to be absorbing. Or it could be blocked closed, with the valves closed on themselves, in which case you'd have a great big backup and you'd have a lot of bloating and gases because of the poisons that are circulating around your digestive system and not being able to be evacuated.
Wow.
Also, with this valve, there can be an impingement. So something from around that area, maybe not even in your digestive system. It could be a misalignment of the pelvis, or it could be a lump, or a hernia. Could be impinging it, so it could be closing it from the outside of the valve. Also, it could be twisted, so torsion. So, and that can close it as well, or partly close it. And when that happens, I mean, all of these situations are greatly painful, depending on how severe the twist or the impingement is.
Yeah.
Greatly painful. And the thing to do about it is to open the valve, and we can do it for ourselves. So I'm not quite at that stage yet, but when I'm at this stage during the Anmo Fu deep abdominal massage, that I'm ready to open it, I'll say I'm going to open it now, and then I'll educate you as to how you can do that yourself in the shower every morning.
Lovely.
And that's for all the viewers as well. Everyone should be doing it every day, just to prevent, make sure it's working okay and it's clear. Yeah. And then you've got another valve over this side, exactly the same reasoning with how it can get blocked, etc., called the Houston valve.
Okay.
So the ICV, your question, is at the end of the small intestine, which is the small as in narrow but very long small intestine. It's at the end of that before it goes into the large intestine, which is the colon. Yeah.
Okay. Yeah.
Whereas the Houston valve is at the end of the large intestine before it goes into the rectum.
Right. Good information.
Probably too much information. Oh, so this is your liver here, and I'm just hooking underneath your ribs, the lower edge of the lowest rib there, and I'm clearing so that the liver has chance to breathe and to have space and to relax and not feel all tight and unable to work effectively. But at the moment that feels really tight.
That's tender.
I bet it is. That feels really tight.
Yeah.
One reason for that can be stress when we're tightening our muscles and our muscles are in spasm around that area, and it's almost like the liver is receding. It's trying to hide behind the hardness of the ribs up here, and as soon as we start letting it relax, it can appear a little bit from below the ribs and take up its space, relax. And then over here under the ribs we have the stomach and the spleen. They don't feel as bad. There is some tightness there, but it doesn't feel as tight as the liver area. So that's another reason for having a deep abdominal massage, because it helps the liver relax and come back into its normal structural place. Now, another reason, not just stress, that can cause the liver to do that is if the liver has a really hard time of being able to assimilate the toxins that it holds away from the body. So it will store things that it doesn't want circulating around the body. And one thing is medication or drugs. Hopefully that will get better and better, but that's a really good reason for having an Anmo Fu to support the liver. So an Anmo Fu is actually a repeat of several techniques 3 times. So we do the whole thing once, then the whole thing the second time, and then a third time. I'm still on the first time at the moment. But you will notice by the time I'm on the second, it will feel easier and more predictable. And then by the time I'm on the third, it will feel so much better. It's quite firm over that top area and into the middle here. And of course you have symptoms of reflux, don't you, and acid. That I can understand, because that area there is so firm, and it's because this compaction, if you like, and muscle tension here is holding it all upwards. Once this relaxes, this will be able to just relax again. I can feel it. Is it sore? Is it too sore?
No, I can, but it's sore.
If you want, I can put a cushion under your knees, or you can bend your knees. That might help the tension in your tummy.
Right.
It's up to you if you want to.
I'll see how it goes.
Yeah.
See if it's still.
Do you do abdominal breathing at all? Because you've just started yoga, haven't you?
Yeah, I do.
Do they do abdominal breathing in your yoga sessions?
Yes, they do. Yeah.
So that's when we, just for the viewers as well, when we breathe in by expanding the stomach, and we pull the stomach in order to breathe out. So it's and even just 2 breaths, I can feel my stomach relaxing straight away, because I'm using those stomach muscles and it's expanding and contracting them. I'm using it like a bellows, and that immediately just softens them and relaxes them.
Okay.
Yeah. So maybe when you're at work, if you can think about it when you're sitting at your desk, or when you're driving or something like that.
Okay.
Try abdominal breathing. Oh, that feels a lot better. That's the second time I've come round.
Yeah, that's not as tender either.
Oh, it's receded.
Yeah.
It's actually more tender here now.
Yeah.
And this isn't bad, but that one's gone.
Yeah. Amazing, isn't it?
Yeah, much softer here. It's a little bit firm here. Can you feel that? Yeah. And more to the right hand side. Okay, so 3 nice long breaths, Juliet. That feels so much better than when I tested it earlier. So this is where the iliosacral valve is. It's halfway between the hip point and the navel. So what I do is I come above it, along that angular line. I secure deep down behind the valve, and because the valve naturally goes in the direction towards the hip, on a nice out breath, when the tummy is nice and shallow, I will then pull the valve and clear it towards the hip point in this manner. So a nice, firm, slow, sensitive clearing. And then maybe a nice, reassuring massage, always gurgling now, on that point in order to reassure the valve that everything's okay. The best time to do it is when you're naked in the shower and you've got some shower gel there, so it's all nice and slippy. You can do it to yourself, so you can put your hands to your hip. So this is, if you like, the same side that the appendix would be, so it's on your right hand side. So you find your navel, your hip point, you know where about halfway is. You get your thumbs either side, above it, nice and deep in, and then pull to that way. And then clear it many times like that. You can do the same every morning, and exactly the same the other side, which will be the Houston valve. And then see how you go, you know. See if the acid and the reflux lessen or even go.
Yeah.
See if other digestive, like the assimilation and metabolism of the food that you're eating is better. Okay, so 3 nice long breaths again. It didn't feel as bad, that side at all, compared to earlier. That feels really good. But the good thing about this is, with you doing it to yourself, you get to know yourself. You get to know how your valves feel in the morning, and you'll know, oh, I know why they're a bit upset today because of that meal I ate last night or 2 days ago, or whatever it might be. And you'll get to know whether they're having a good day or a bad day and what to do about it. Taking ownership. And the reason I get rid of the oil at the end, although you can still smell all the essential oils, but the actual carrier oil, is because that will have absorbed any toxins that, because of the abdominal massage, have come out through the skin. So we want to get rid of those and put them in the bin.
Right.
Just going to retest those 2 areas. So can you put 2 fingers in there and give me a nice straight arm and hold? Nice. No, absolutely nothing. And then 2 fingers deep into there, arm up and hold.
Amazing.
Oh, you're so much better.
Yeah.
So much better. It's just a nice reassured hold. It's like you're really strong and you're like, I could hold that for 10 hours.
Great.
Right, you can turn over.
Okay.
So, giving the back a little Tuina for a little assessment. See what it's telling me. Moving nicely at the moment. nice into the hips, sacrum, lumbar, a little bit tight here, just on the other kidney. Not too bad in the mid-thoracics. And then coming up to the upper thoracics, to the cervicals. Not too bad actually, a little bit tight here. But I'm always assessing the spine by looking at how the pelvis rocks. Whether I'm down at the pelvis or actually moving into the upper spine. And it's moving nicely, it's not overextending. It's just a lovely wave-like motion. But yeah, I'm definitely feeling some tightness at the kidneys. I think they need a little bit of love. Maybe a bit of water and some warmth. That's what the kidneys like. So just giving them a little rub. So I'm just going to help the thoracics by doing a wing stretch each side. So relaxing the elbow down, lovely. So letting it go. And then I'm just picking up the scapula, rotating, pulling it away from the spine, giving the back some space. That's it, lovely. So that's it, just letting the arm go if you can, if the shoulder will relax. So I've got the bottom of the scapular point there, and I'm just separating it from the rest of the back, pulling it out, letting it relax, coaxing and encouraging. Lovely, and then a little bit of a walk down each side of the spine. Putting my whole body weight. As the spine tips side to side, loosening and softening, allowing for some space. And a little scapular float. Feeling the scapula relax and lower. Rotating into the toe to help the neck and the head. Some clicks. That's it, far looser. And then pushing the toe pad down, creating a gap at the thyroid, down from the kidney and adrenal to the bladder. Softening the foot. repatterning for the knee, leg and pelvis. That's it, nice and heavy, heavy, heavy. Letting the opposite hip rise. Beautiful, it's just so good for repatterning the spine and the pelvis. Yeah, there's some arthritis in these feet. So just creating some space, easing the muscles and the bones. And then the whole foot. And then the sacral fix. Letting go, letting go. I've got you, floppy doll. Beautiful. Lovely, really good, Juliet. And I'm just going to work into that piriformis by holding the muscle while I'm stretching it with that movement through the leg. Yeah. Letting go. And a sacral float. Relaxing into the whole spine, letting the pelvis go heavy, sinking, getting heavier and heavier, realigning and finding balance. Connecting top and bottom of the spine and the cerebral spinal fluid. Beautiful communication and connection going on. And now we're lengthening. So good. Okay, in your own time, if you'd like to turn back over, Juliet.
Oh, I can feel all that working.
Yeah.
Yeah, it's sort of quite a strange feeling through
It
the
is.
legs when you're holding the bottom of my spine.
Yes.
Yeah.
Yeah. When I had both hands on the bottom, and yeah, it is. Yeah, so that's called Gong. It's a kind of healing. Right, let's have a look at those knees. So I'm going to do the good one first.
I supposedly the good one.
Well, the one that's giving you less symptoms. Is that right?
Yeah.
Because this one, yeah. So, interestingly, immediately that I feel the knee, knowing that we did the kinesiology and it came up with some tightness here, failing the kinesiology tests top and inside, I'm actually feeling a lot of tightness on the outside here in the bone, so I'm just going to work on it and see what we can achieve. feels so much better. Still a bit stuck on patella. Oh, there we go. Okay. There we go. And just bend your left knee. So I'm moving it around in order to work out what the knee can achieve with movement, and obviously I'm feeling underneath it with my knee, to the sides, the top with my hands. And again, interestingly, the tightness is on the outside, even though it failed on the inside. There's certainly some tightness on the inside there, but on the bone on the outside it just feels really caught. No, it's loosening now. Well, it feels better, but still could be even better. I'm just going to hold it for a while. And I'm visualising some beautiful light in the middle of the knee, taking on a colour. I can't stop thinking about yellow, so it's going to be a yellow light. And sometimes a chakra that is stuck in the body, so yellow would be the solar plexus, sunlight, can be caught in another place of the body, so maybe for some reason the solar plexus is not letting the knee to heal. So I'm sending the solar plexus some love from the knee. The yellow light expanding, and a beautiful musical note I can hear in my ears. And the knee starts accepting some space, some softness, letting go, letting go, letting go, letting go. Oh, that's good. That's good. New towels. Just arrived. So I'm just going to move your hair out of the way. Lovely, thank you. That's it. Shifting the upper thoracics left to right. seeing if they're stuck or mobile. And then the cervicals of the neck. Ooh, lovely, really good. And lovely neck release. Letting it go nice and heavy all the way tilted back. And I'm just going to have a little look at the side of the neck and the back from the left hand side, moving each vertebra in turn. Oh, it's quite tight at the top. Oh, it's almost like I can feel it in my neck when I'm feeling someone else's. Yeah, it's quite tight at the top. Okay, let's give it some love. I'll come back to that side. And then to the right side, pushing each vertebra down from T1 up to C1. Oh, again, quite tight at the top. This is probably a keyboard neck, I'd have thought. One where the neck is tilted at quite an angle, looking down close to the body. Oh, not as bad on the processes. A little bit here, that's probably quite sore there in C1. So lifting the head so it's off the cushion, and then I'm able to move the processes a little more by using the weight and gravity of the head. Lovely, really good. And now back to the other side, see if it's better now I've worked on the right. Up into the air. Moving those processes. I think they're going to need a few treatments. Lower down isn't quite as bad, but from about there upwards, they are quite tight, stuck. Okay, let's give it some love. So at another time, if the stomach isn't shouting as loud, I might be able to do some cupping on the back, and that will help the neck as well. Lovely, good. And another neck release. Pushing the shoulder down. Oh, wow. Really good, much better flexibility on the right hand side compared to the left. Let's try that one again on the left. So it's not moving separately, the whole body wants to move when I push the shoulder. The head and neck are coming over. Really, this should be bouncing down on its own, but it's pulling the head. So this is what I would want to work on next time. This area here, coming up the side of the neck, bones and muscles, sternocleidomastoid. This is what needs some more work. Back to the centre, and and a little stretch, followed by a minute or two of temporal, occipital, Qigong float. Within my hands, feeling the cranial bones relax, feeling them loosen their grip, expand with every in-breath, feeling the contraction, while with the out-breath there is a beautiful expansion. And now I can feel the movement within the head as the breath circulates. And there is a most wonderful internal movement of energy that presses to different parts of my hands and heels of my hands up to my fingers. I could sit here all day. Wonderful. So, taking a few deep breaths and sending your breath to your hands and your feet. Stretching through palms and soles, splaying fingers, playing the piano, widening the palms, and then playing the piano with your toes, and circling into ankles and wrists. And then arms over your head for a nice long body stretch. Okay, so I haven't quite finished. Some of the tests that didn't pass earlier, we're going to retest now and see how they are. Your left arm and your left leg together, hand off your hip. I'm going to push with both and hold. Much better, lovely. I want to retest the inside of this knee, arm up and hold. No brainer. And hold. Easy, and I'm really pushing. So that was that, and of course we know the stomach has passed because we retested both valves.
Yeah.
And that felt a lot better
Yeah.
anyway, didn't it?
Yeah.
How you
Really
feeling?
did. Yeah. Really did.
Yeah.
I feel great. Yeah.
Well, the proof will be in the pudding when you go out and go about your daily life of things that normally give you symptoms and pain and
Yes.
weakness and whatever other symptoms you're getting, and hopefully you'll feel a lot better and stronger.
Great.
My pleasure.
Yeah, I loved it. Thank you very much.
Oh,